fun. She will make your understanding about your different subject matter simple and fun to learn.
Hi everyone, I'm Nurse Anne, and today I will be discussing about pneumonia. What is pneumonia? According to the World Health Organization, it is an acute respiratory infection. So it is an inflammation of lung parenchyma due to an infection. It affects the alveoli, which are located inside the lungs, and it is responsible for gas exchange. The inflammation in the alveoli produces exudates that will obstruct with the circulation of oxygen and carbon dioxide into the lungs. So for short, pneumonia is an inflammation of either one or both lungs that affects its alveoli, which is responsible for gas exchange. Etiology or causes. There are a lot of microorganisms that causes pneumonia, but the most common are the virus, bacteria, and fungi. The most common cause of bacterial pneumonia in children is Streptococcus pneumonia, while the most common viral cause of pneumonia is the respiratory syncytial virus. We have 4 types of pneumonia. First, we have the community-acquired pneumonia. From the name itself, the infection was acquired in the community setting and within the first 48 hours after hospitalization. Second, hospital-acquired pneumonia. They also call it nosocomial infection because the infection was acquired in the hospital or other healthcare facility. The onset of symptoms is more than 48 hours after admission. It is the most fatal nosocomial infection. That's why it is the leading cause of death. Number 3, pneumonia in immunocompromised hosts. This is caused by an opportunistic organism due to the decreased level of immune system of a person. Number 4, aspiration into tracheobronchial tree or aspiration pneumonia. This happens when aspiration of foreign substance goes into the lungs. Mode of transmission. First is via droplets. This is when the infected person coughs or sneezes near you. Second, touching contaminated surfaces. Then accidentally or unconsciously, you put it into your eyes, nose, and or mouth. Risk factors. First, we have smoking. Smoking damages the body's natural defenses against the different bacteria and viruses, which can increase the risk of a person who is smoking. Second, extremes of age. It is the very old and the very young people. Third, being hospitalized. Fourth, patients with chronic health conditions like asthma, COPD, and lung or heart diseases. Fifth, the immunocompromised. Being hospitalized, patients with chronic health conditions, and immunocompromised, these 3 factors have low or weakened immune system which put them at risk to pneumonia. Prevention. First, we have the vaccination. Avoid overcrowded areas. Proper waste disposal. Respiratory etiquette. This is by covering your mouth and nose while coughing or sneezing. Proper hand hygiene for 20 seconds using soap and water or use an alcohol-based hand rubs if you are outside your house. Cleaning, disinfection, and sterilization. We must observe a clean environment. Disinfect the things that usually brought outside the house and most commonly touch objects inside the house. Proper sterilization must also be observed in the healthcare facilities. Avoid touching your nose, mouth, and eyes. You can do this after doing proper hand washing. Proper health education is also important. And finally, boost your immune system by eating nutritious foods and daily exercises. Signs and symptoms: we have productive cough, which may produce greenish, yellow, or even bloody mucus. Difficulty of breathing, fever, pleuritic chest pain, and fatigue. Diagnostic exams. First, we have the blood culture and sensitivity. This test detects which organism is present and which drug it is most sensitive with. Second, chest x-ray. This helps the physician to diagnose pneumonia and to identify the location and extent of infection in the lungs. Third, sputum culture is the use of the infected person's sputum to detect and identify which organism infects the lungs. CBC, or the complete blood count. WBC is usually high due to its response to infection. It may have a lower result if it's a viral infection, immunosuppressed conditions such as AIDS, and overwhelming bacterial pneumonia. Erythrocyte sedimentation rate, or ESR, is elevated. Let's now proceed to nursing interventions. Proper nursing assessment and monitor the vital signs. For difficulty of breathing, position the patient on semi-recumbent position, the head and torso at angle of 45 degrees. Give oxygen as ordered by the physician. Monitor the vital signs and the oxygen saturation of the patient with the use of a pulse oximeter. For the pleuritic chest pain, position the patient to alleviate the pain. Teach the patient to support the rib cage when coughing and deep breathing. Administer the pain reliever as ordered. For the presence of fever, perform tepid sponge bath or educate the patient's significant others to do it. Advise the patient to remove thick clothing. Advise adequate hydration. Give the antipyretic medication as ordered by the physician. Monitor the vital signs. If the patient experiences fatigue, encourage to avoid overexertion and possible exacerbation of symptoms. Provide rest periods. For the presence of phlegm or secretions, hydration is advised to loosen pulmonary secretions. Humidification and chest physiotherapy as ordered. This will help loosen and mobilize secretions and improve ventilation. Lastly, administer antibiotics and bronchodilators as ordered.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. And if you want Nurse Anne to discuss something related in your nursing subjects, just feel free to leave a comment. See you in the next video!